Welcome back to East Texas Live on KETK. It's National Eye Transplant Month.
And joining us in the studio is Clayton Whitney with Trinity Clinic Eye Center. Good morning.
Good morning. It's nice to be here. Thank you for having me.
Happy to have you.
Okay, so we were talking about it beforehand. We didn't even know that there's an eye transplant. Now, can you kind of clear the air for us a little bit?
Absolutely. If we look at this model eye, the front of the eye is the cornea, and that does most of the focusing power of the eye to bring rays of light on into focus on the retina back here. So the light goes through the cornea, through the pupil, through the lens of the eye, and then lands on the retina. And the cornea can be transplanted. So fortunately, we have people that donate their eyes after death. It's a living organ. It's the most widely performed organ transplant.
Wow.
There are around 40 to 50,000 transplants performed in the United States every year. Wow. And because of medical examiner laws, they can actually remove corneas if they cannot find a living relative, but they prefer to have corneas donated voluntarily by people who donate their eyes after death. And the cornea can actually be removed. It's not observable after death. The cornea can be stored for up to a week and preserved, and then the surgery can be actually scheduled and the cornea can be replaced. When we work on the cornea, we remove either the central 2/3 of the cornea, or we can do just the lining of the cornea. That's a new procedure that I actually went up to Indianapolis to learn in 2006 from Dr. Francis Price. And that's been very successful because people recover much more quickly and they see better with much less astigmatism. If you can imagine, the full thickness cornea transplant their stitches all the way around, and they stay in up to a year on the cornea. With this where we just do the lining of the cornea, there's only 1 or 2 stitches off to the side, and they recover much more quickly, and they don't have a lot of irregularity, so they see better. So sometimes things that can cause you to need a cornea transplant, this person had a fever blister in their eye which actually scarred their cornea, and so they later had a transplant. And then another person, I can actually show you a picture here of a gentleman who was actually in his 40s. By the time I met him, he had had 2 cornea transplants, and it was all caused by a fever blister in the eye. So then they came out with some medications that could suppress the fever blister. He had a rejection, but he had perfect vision. He could see unusually well to have had a transplant. And so I did a partial transplant behind his full thickness transplant. So we took the inner part of the cornea and got it to stick to his cornea. You can actually see a picture where there's an inner cornea here and an outer cornea there. And he was able to get 20/40 vision, which is good enough to pass a driver's test, and he was able to keep his job.
Awesome.
So it's been very rewarding. We get our corneas mostly from the Southwest Organ Bank at the University of Texas Southwestern Medical School. And I've enjoyed teaching there for 25 years.
Wonderful.
Teaching residents. And they run a very good eye bank, and they will actually facilitate donors from our area. They'll come over to East Texas and help out.
How common are eye transplants here in East Texas?
Well, if you look between Lufkin, the Red River, Shreveport, and Dallas, there are approximately 60 to 65 transplants a year. And in Tyler, I do a little over half of those.
Well, donations are
region.
Probably really important then.
They're very important. And they're able to even take corneas from people that have had previous cataract surgery. They can actually look at the cornea and see if it's able to be used for transplant. And many times they can still use it for research. They're looking into growing the lining of the cornea, growing the cells from the cornea, and being able to transplant just the cell layer. So there's a lot of research going on to try to facilitate transplant and prevent blindness.
Wow. Well, I have learned a lot this morning.
Yes.
Thank you so
Great.
much.
My eyes have been open.
Great. Well, thank you so much for having me.
All right,
Thank you.
Thank you.
And attention basketball fans, after the